Myotonia, how to demonstrate. Myotonic problems are not very uncommon among patients. How can a doctor detect it without much problem? Here's a patient who complains of weakness and dysarthria. As he comes in, the doctor can shake hand with the patient. Then he will be asked to relax. As you can see, this patient finds it difficult to relax. So this diagnosis can be detected as and when the patient introduces himself to the doctor. So delayed relaxation is seen and muscle is still in contraction even after he has withdrawn. Myotonia can be percussion myotonia, where you percuss a muscle and you can see a dimple appears at the site of the tap, and then after few minutes only it will refill because relaxation is very slow. This is one example of percussion myotonia. Myotonia can take different ways. One technique is to give shake hand to the patient. Next one is to see percussion and confirm it is possibly myotonia. In all the patients, all the findings may not be there. And here is same patient, you are tapping the dorsum of the forearm and the hand goes into dorsiflexion, but then relaxation is very slow. So myotonia is basically the process of contraction of muscle and very slow relaxation. Very classically seen here type of percussion myotonia. Percussion myotonia can also be detected by percussing the thenar eminence, where you find the thumb goes into contraction and then very slowly it relaxes. Here other side also you can see the contraction is abrupt and the relaxation is very slow. Now, as and when you start examining the patient, easy to do it by showing grip myotonia. Here patient is gripping the hand. Patient is asked to grip and release, and you can see gripping is okay, but relaxation is very slow. It's rather incomplete. And whichever muscle you tap, a dimple is likely to appear. And here we are trying to demonstrate a dimple, percussion myotonia, over the muscles of the thigh. And you can see again a dimple appears, but very slowly it relaxes. Same thing occurs when you elicit tendon reflexes, then we contraction and very delayed relaxation. Another technique of demonstrating myotonia. The contraction is followed by very slow relaxation. In any step of motor system examination, myotonia can be missed or can be detected. So keep it in mind how to elicit myotonia. As and when the patient comes in, you give shake hand and introduce, and then you can ask the patient to clench and release to show the myotonia, or ask the patient to grip the fingers and see what happens. Percussion or directly the muscle or over the tendon jerks can also detect myotonia. This particular patient has got difficulty of all the muscles, but he is very vague about his symptom. He says weakness. Obviously, there is no paralysis. What happens is he is finding difficult to relax the muscle. That's why he says there is weakness. High index of suspicion and proper technique of examination can detect myotonia. Myotonia can occur in all the muscles, including tongue. And when you examine the tongue, you percuss and see what happens. And the part of the tongue which is percussed goes into contraction and does not relax, as you can see here. Again, we can see the same thing. So this patient's complaint dysarthria is basically because the tongue is not relaxing at all. So here today we are demonstrating how to detect myotonia by shaking hand with the patient, asking to give a clench and then relax, percussion over the muscles or the tendons or over the tongue. This is how myotonia is detected.